Hey folks, and welcome back. I'm Eric Sunset, your host of the Doc Buddy Journal. Here at Doc Buddy, we deliver healthcare solutions that take the pain and costs out of broken workflows like OpNote, which gives ASCs the power of instantly generated operative reports approved from the point of care. You can learn more about OpNote and our other solutions at docbuddy.com. Thanks for joining us today. We have the unusual solo show after a month and a half of ASCA focused podcasts in the run up to their annual conference. Fantastic event, by the way, as it always was. This one was at the Gaylord Palms in Orlando. Then we had Andrew Lovewell on the show, a widely recognized name and face in the ASC space. And all of those episodes are available on docbuddy.com/blog, YouTube, Apple Podcasts, and Spotify. So you can take a look back at our category. And today we've got something just a little bit different for you. And in some ways, it's a callback to one of our very early episodes where we took a look at an Arch Collaborative report. And Arch Collaborative, of course, is a part of the KLAS Research family. And they did some really good work and continue to do really good work looking at factors that drive physician burnout. And like I said, we looked at this really early on in this show, episode 1, if I'm not mistaken. And today we are going to look at a newer version of the same type of reporting. It's a KLAS Arch Collaborative Reports article titled Understanding and Addressing Trends in Physician and Nurse Burnouts in 2024. Of course, want to thank the authors of the report. It was written by Connor Bice and Miles Hepworth. Keep up the good work, folks. And then as we look to the new set of data, the original report that we looked at was actually titled Provider Burnout Has Leveled Off. And if you're a longtime listener of the show, you may remember that one. That was a fairly long monologue digging deep into that report. I don't think we're going to go quite that deep into the report on today's episode, but we do want to call out what's changed. What's the delta between the data in that initial report we looked at, which is from 2021 and 2022 versus 2018 to 2020 data. You all haven't forgotten about the COVID-19 pandemic, have you? So pretty timely set of reports, or data sets rather, in that report looking pre and post-pandemic. And when we look back in time, so again, this is the initial KLAS Arch Collaborative report that we looked at, the top contributors to burnout. Again, this is self-reported by physicians. Too much time spent on bureaucratic tasks, after-hours workload, EHR or other IT tools hurt my efficiency, no personal control over my workload, chaotic work environment, and so forth. Essentially, each one of those measures increased post-pandemic. And there's a lot of reasons for that. Obviously, the pandemic drove a lot of heartburn and a lot of heartache in healthcare. So I'm not sure that these things can be totally attributable, in a vacuum to the self-reported cause, although some of them can. And then the one really interesting piece is when you look all the way down this list of contributors to burnout in that initial 2021, 2022, 2018, 2020 data set, staffing shortages were just about at the bottom of the list, with only 13% of respondents giving that as a reason for their burnout. When we look at this new report, the report has been published for a while. We'll obviously share a link to that article in the show notes. I want to be sure that we spread the love here to KLAS because they do really good work. But this new report shares that burnout rates remain higher than pre-pandemic levels and that they're beginning to stabilize for some and slightly decline overall. Some of the other key takeaways from the headline were that staffing shortages have been increasingly mentioned as a contributor to burnout. For those in the ASC space in particular, those in the physician practice space, and those in any space in healthcare, they'll know that that is a reality that they are having to face. Practices, physician organizations need to do more with less than they've really ever had to do, primarily due to the inability to hire and retain staff as a whole. Obviously, we talked to Andrew Lovewell last week. We've talked to Todd Currier up in Bend, Oregon. With the right culture and the right processes, you can still make your healthcare organization a really attractive place to work. So that's not to say that it can't be done, but times have certainly changed. Another key takeaway here is that those who have started to feel burnout cite efficiency-related issues as reasons for it, while those who are completely burned out cite concerns related to the organization more broadly, like a lack of alignment from leadership. And I think that's a really interesting distinction because you have those who are starting to feel burned out versus those who are saying, I am burned out. I'm completely burned out. And then as sort of a no-brainer here, the severity of clinician burnout and their likelihood of leaving their organization are strongly correlated. And for those who need a refresher on their high school statistics, correlation shows that there's some relationship between these two things. If there's more of one, there might be more of the other. If there's less of one, there might be less of the other, or some combination of less and more. Causation would give you the reason why something is happening, and it's fairly obvious. And the KLAS report can't say this. I don't want to put words in their mouth, but sitting in my seat here, the severity of clinician burnout and the likelihood of leaving an organization are not just correlated. There's causation there. And there's a bigger macro picture to this, right? That there is an ongoing cataclysm that you've heard me mention before. We're already seeing a shortage of physicians. They're retiring early. Medical students aren't going through medical school at the rate that we need them to replace these physicians retiring early or leaving medicine outright. So there's not really an answer for exactly why that's happening on the medical school front, but clearly the severity of clinician burnout and the likelihood to leave an organization or leave medicine altogether, pretty confident in the causation there. What caught my eye, and why we're going back to this well, and I think the reporting is really worthwhile, and I'll encourage you to click through in the show notes, take a look at the data for yourself. If you're a KLAS subscriber, you get even more data. And as a matter of full disclosure, DocBuddy has no relationship with KLAS. We are not a partner vendor, but they are a voice in the marketplace that should be listened to. And so coming back to the point here, the part that really surprised me was that the rates of self-reported burnout have actually decreased. And there's a really great graph on the site that the trend in burnout among physicians and nurses from 2018 to 2023, you can see it's a fairly positive trend line. And by that, I mean the rates of burnout go up over time from 2018 till 2021. You hit 2022 and it's essentially flat. The data shows a 1 point difference or 1% difference in both the physician and nurse responses here. And then really unusually, really surprisingly, is that through 2023, and obviously we're in 2024 now, so there isn't any 24 data to look at yet, but the most recent data that is shared is that those rates of providers reporting burnout have decreased by 2 points respectively for physicians and nurses, down from 36 to 34 and then 34 to 32 for physicians and nurses. That is shocking to me with the amount of guests on the show who have shared just how tough times are, both for their physicians, their staffs, and their facilities. But I think that's a good thing, I think. Because when you look at how data is captured and how these surveys work, are people acclimating like the frog in the boiling pot of water? Or if you put a frog in a pot of just room temperature water and you put it on the heat, it won't jump out once that water starts to boil because it's acclimated. It is used to the hot water. Whereas if you put a frog in a pot of boiling water, it jumps out. At least that's what the science says, and the old trope would have us believe. So is there really a reason that burnout is decreasing, or are we just acclimated to this new normal? I think that's a fair question. It's probably a little bit of both. As with most things, the answer will lie in the middle. So we leaned really heavily on the contributors to burnout in this initial look at the Arch Collaborative data. And again, going back in time, too much time spent on bureaucratic tasks, after hours workload, and then EHR or other IT tools hurt my efficiency were the top three in that initial report. And I think those three things are interrelated. When you look at EHR, after hours workload, and too much time spent on bureaucratic tasks, we'd have to really kick the tires and get under the hood to know how this data was collected and how the questioning was phrased. But you can point a finger at the EHR for being the root cause of all three of these concerns, which would make EHR far and away the number one contributor to burnout. We've talked about it at length on the show. Legacy tech doesn't always have the physician first, at least in terms of their direct and explicit workflow and the way that they use these softwares for a variety of reasons, which we won't go over again. But looking at the new data, or the newer data, because as we said, this report was published a couple of months back, the new top contributors to burnout are staffing shortages, too many bureaucratic tasks, a chaotic work environment, no control over the workload, after hours workload, and then EHR inhibits efficiency. And that's only about half the list or a third of the list of the contributors to burnout listed. And there's a split between physician and nurse response. So just quickly here, I know this is tough without a visual on screen. Again, click through the link, you'll be able to check out the data for yourself. But a couple of call outs that catch my eye. Staffing shortages, worse for nurses than for physicians. Bureaucratic tasks, no control over workload, after hours workload, EHR inhibits efficiency. And again, I think those things are pretty tightly related when the EHR is the system of record for a physician. All of those things are reported as worse by the physician than by the nurse. Now, chaotic work environment does skew pretty heavily towards a nurse response, 10% more or 10 points more on the nurse side than the physician side. So not a whole lot has changed with the exception of the staffing shortage. And we've had guests on the show before, experts in medical office and medical facility staffing. There isn't really an answer. Nobody can point to one thing over why it's so difficult for medical organizations to hire and retain staff. There's pay dynamics between the practice, the ASC, and the hospital. Who's paying me the most? That's certainly a factor. But even keeping that equal, there isn't really a great reason why in 2024 and in 2023 as well, which is the data that we're looking at, why that is such a difficulty for these provider organizations. And I'll share a quote here from the authors of the report that, quote, in general, physicians and nurses feel they're overworked, and those experiencing symptoms of burnout report multiple contributors, end quote. So it's important to note that this is not a single selection for your contributors to burnout. It's sort of a mix and match. You tell us which ones are hurting you, and those are all counted into the same data set. So it's not just one thing that's driving burnout sentiment in this reporting. A couple more highlights from the table on just physician burnout. So you can take a look at the highlights for just nurse burnout in the report, but that the contributors to burnout for physicians who are burning or completely burned out is slightly different. And those that are completely burned out obviously are saying things that are worse than those who are just starting to burn out or beginning to feel that way. That the no control over the workload, the chaotic work environment, the lack of shared values of leadership, lack of autonomy, EHR inhibits quality. Each of these things are worse for those that are completely burned out than those who are just beginning to feel that sensation. And I think there's something to that frog in the pot of water versus the frog in the boiling pot of water here. That if you are already fried, anything else could be the straw that breaks the camel's back, and you just throw in the hat and say, I'm all done. Time to retire, time to move into a different area where I can leverage my medical degree. But the bottom line from the report is that to alleviate burnout, both physicians and nurses want improved staffing and better alignment from leadership. Physicians also want improved EHR efficiency, while nurses want better pay. Now, I don't want to stick my nose into the nurse compensation discussion that is ongoing. We've seen a lot about this since COVID. Traveling nurses are able to sign huge bonus checks, get a lot more money from their employer versus those nurses that aren't traveling around and moving employer at whatever period of time. Certainly a factor there. Those nurses that have stuck it out at their facilities or at their organizations are feeling pretty hard done by those that show up for 6 months, 9 months, whatever the case may be, make a ton more money and then leave. And there's even commentary out there that these mainstay nurses that aren't moving around are having to pick up the workload for those that do move around. When you look at sort of the end goal of getting reporting like this or statistics like this, which is how do you fix it? What do you do to make things better? KLAS once again did a great job splitting out nurse responses from physician responses, but there's a few things that really stand out to me. Everybody wants improved staffing, so more staff. Nurses are asking for that at a much, much higher rate than physicians are. And that seems to make sense to me when you look at the work product of each type of clinician. Obviously, physicians, very patient-centric. Nurses doing it all. So shout out to all of our nurses out there. This calls to me, though, too, that the healthcare fix of just hiring somebody to solve a problem, I think gone are the days of doing that regardless of the ability to hire and retain staff, especially when there's so much new and so much good technology out there that can automate a lot of these paper moving processes or data moving around processes. You hear a lot of talk about AI in healthcare. Some of the administrivia can be removed from the equation if the provider organizations are willing to look at and adopt new technology. So I don't want to say that that's self-inflicted, because there's certainly a staffing shortage where being able to improve headcount, being able to improve the number of FTEs in your facility does and would make a difference. However, maybe you don't need to hire quite to the pre-pandemic levels that you think you do if you're using technology, as in like using DocBuddy, that you would think you would have to. Aligning leadership with physicians and nurses is fairly evenly split. Providing better pay skews really heavily towards nurses. Improving EHR efficiency skews really heavily toward physicians. And let's look at that for just 1 second too. There's certainly instances where EHRs just are not as efficient of a tool as they could or that they should be. But let's put a little bit of onus back on the provider here too, that there's a basement threshold for buy-in and training and being able to learn the software that needs to take place. Still seeing that out there in the market. So that is not me being an apologist for the legacy technology that's in use at so many healthcare organizations, but it's a two-way street to an extent that you've got to have that provider buy-in. And then looking through the rest of the list, enhance EHR education, that's a very small subset of the responses on ways to alleviate burnout, limiting toxic culture, improving quality of care, adjust patient message volume. These all really pale in comparison to improving staffing, aligning leadership, better pay, and EHR efficiency along with workload. Each of those sort of subsets, and there's even categories with less responses, these are 5 and 10% of those top 4 ways to alleviate burnout. And just want to share a quote that drives this point home around EHR problems, quoted from the article, obviously. So, quote, "My main pain points are 1, the amount of work I take home and the amount of administrative work I do during non-clinical days, with the added bonus that all administrative work is uncompensated. 2, the out-of-control in-basket, so inbox, that I cannot keep up with. 3, poor access to my patients because my schedule is filled up with other people's patients. And 4, the fact that the panel size is too large and still growing, resulting in us seeing an average of 6 to 8 new patients per day." Let's break that down a little bit. So pain point number 1, the amount of work I take home and the amount of administrative work I do during non-clinical days that's uncompensated. That's an EHR problem. That's a lack of the right technology. And not to lay it on too thick, but obviously DocBuddy providers, whether they're in the clinic, the ASC, or whether they're on call, that's one of our value adds to the market, is that providers are able to have dinner with their families. They're not doing pajama time charting. They're not having to work on the weekends when they need to recharge. And everybody needs to recharge, regardless of how big of a workaholic you think that you are. You cannot be doing the same thing 24 hours a day, 7 days a week, forever. Eventually you break. So this pain point number 1, truly a legacy technology problem. Second pain point, the out of control in basket that I cannot keep up with. So I read in basket as in box, it's in basket in the article. That's tough. We've talked about this on prior episodes of the show. Some healthcare systems and some practices and organizations are charging now for patients to send messages to their provider via the patient portal. That puts the incentive chain in a little bit more alignment. If you really want to talk to our doctors, you're going to have to pay. There's also been topics discussed on this very podcast that look at the ability for AI to respond to these sort of run-of-the-mill messages. That brings along another set of hurdles and challenges for that provider organization to be sure that AI is the right tool for the job, and that it's sending appropriate and relevant information back and keeping that message out of the provider's inbox. And then 3 and 4, man, if I've said it once, I've said it a million times. This relates exactly and directly to the shortfall of physicians that we have, whether you're in a major metro like I am down here in Miami, or whether you're in a more rural area. Poor access to my patients because my schedule is filled up with other people's patients, and the fact that panel size is too large and still growing, resulting in us seeing an average of 6 to 8 new patients per day. And if there were more providers, you wouldn't have those issues. So that's a big problem to solve in this market. How do you get more people interested in becoming doctors or providers of any type or clinicians of any type, to be clear? Some of it's catch-22. Some of it's a little bit chicken and egg, right? Like we look at all this data around burnout. Providers are undoubtedly burned out. Nurses are undoubtedly burned out. If you're going into college, would you really want to sign up for that career where you're burned out all the time and all of your predecessors in that career path are retiring early or leaving medicine or just grinding it out, becoming burned out? And the answer is no. So you need to be able to fix that. Better technology and, more recently being able to hire and retain employees, aligning your leadership with physicians and nurses, providing better pay. And better pay, man, the reimbursement issue just cannot, it just seems like there's no end. Provider organizations are getting squeezed at every level. All that to say, coming back to the central point, stepping down off my soapbox for just a second here, that you can fix this physician's two of their top four pain points with more providers being able to render service to more patients. Whew. Man, so that got a little heady and a little dark there. There is a glimmer of hope. I think it's more than a glimmer of hope too. I think it's less frog boiling in the pot without knowing it, and more that things are starting to turn a little bit of a corner. Better technology, being able to keep physicians and clinicians focused on their work. The phrase is working at the top of their degree. So you don't have mid-level providers handling patient paperwork, things of that nature. The medical organization community is seeing that those things don't work. They're seeing that you can't just hire an FTE to solve a manual problem, that there's a better way with technology, with automation, with being able to move data around without needing to fax it. So the fact that in this report, the trend in burnout is down from 2022 to 2023 after it had increased for 5 straight years based on this data, that's good. That's a really good thing. And that makes me even more excited about what we're doing and what we're building here at DocBuddy to be able to give providers more time for life, providers and their staffs for that matter, being able to access, create, and move data from the point of care. That's the key. More legacy tech does not fix the overarching concern with all of these burnout considerations, which is the bad technology that so many have been forced to use for so long. And as we look to put a bow on this longer than intended monologue, there's hope at the end of the tunnel, or there's a light at the end of the tunnel that isn't a train, rather. And on behalf of the entire DocBuddy team, I want to thank you for listening. Be sure you're subscribed on Apple Podcasts, Spotify, and YouTube so you can always hear and watch the newest episodes of the DocBuddy Journal. And until next time, I've been your host, Eric Sunset. It's been great. Talk to you again soon.